Well, a few weeks ago, my neighbor Pascal asked me if I could help him with a phone bill, which he didn't understand. My neighbor is a fine old gentleman of around 80 years. We see him sitting on the bench there on the left side. And he has really poor eyesight due to his diabetic retinopathy. While we were standing at his desk, I noticed that he had problems reading the bill with his reading glasses, and he was not using the stand magnifier sitting on his desk. When I asked him why he was not using it, he complained that it was brand new and no good. No help at all. Because when he looks through it, everything appears blurry. Pascal and the magnifier gives a blurry image of the phone bill. Well, I think you all agree that magnifiers are one of the most helpful visual aids for visually impaired people. They are the aid of choice when spectacles are no longer enough. So how come this useful aid ends up standing idle on my neighbor's desk? In my 18 years of advising my partners in the low vision sector, I noticed increasingly that eye care professionals who dispense normal spectacles seem to shy away from offering low vision services, which also includes professional, proper dispensing and training of magnifiers. Why is that so? Well, the reasons are manifold. Some claim that proper low vision care takes up too much time compared to the economic benefit. They compare the time and effort they spent on selling and fitting a designer frame with high-grade coated progressive lenses with the time they need to properly fit and dispense a magnifier. What's more, in many countries, low vision care often only takes up a very small part in the training of eye care professionals. So they are often afraid of not doing it properly, of making a mistake. As a result, many eye care professionals either do not sell magnifying glasses at all, or they only offer them as commodities. They have a take it or leave it approach. This is what I have to offer, have a look and see if you can find anything that fits your needs. Professional fitting and dispensing of magnifiers is something completely different. And it can also be even more profitable than just selling the magnifier. To fit an optical magnifier, several steps are needed. First, you determine the magnification power needed for near vision at ambient lighting. Second, you choose the correct power of the optical magnifier. Third, you test the lighting requirements. And fourth, you select the best suitable type of optical magnifier. If we still have a little bit of time later, we can talk a little bit more about those 4 steps, but the main topic of this lecture is another important but often forgotten step when you decide on a stand magnifier. You need to adjust a pair of spectacles for use with the magnifier. Before I tell you why, let's take a quick look at the advantages stand magnifiers offer, which make them quite popular with many visually impaired people. First, when weighing up what type of magnifier is going to work best for your patient, stand magnifiers are unbeatable when it comes to shaky, weak hands or limited manual dexterity. For example, due to a stroke. In this case, patients will find it difficult to hold a handheld magnifier. Second, Stand magnifiers are the aid of choice when using the magnifier for a longer period of time, for example, when reading a book or a longer text or a newspaper. This can be quite tiring and exhausting with a handheld magnifier, even for younger people. Third, illuminated stand magnifiers in a closed housing provide a much brighter spread of light than hand magnifiers. Due to the bright light reflecting material of the magnification head, illumination of the object viewed is further enhanced. Stand magnifiers are also known as fixed focus magnifiers, which brings me to my fourth key advantage. They constantly maintain the magnifier to print or object distance. It is not necessary for the patient to worry about controlling the focal length. While this is a great relief, it can also cause problems which the patient wouldn't have with a hand magnifier. To avoid these problems, it is important to perform another step, namely adjusting a pair of spectacles for use with the magnifier. As you all know, our eyes lose the ability to focus on close objects as we age. At the beginning, we automatically hold the object further away, and all of a sudden our arms are too short. We then go to the eye care professional and get a pair of reading glasses. Problem solved. At the beginning, we may need an addition of 1 or 1.5 diopters, and later on perhaps 3 or even 3.5 diopters. Now, when, as in the case of my neighbor Pascal, a magnifier is needed for pathological causes, such as a diabetic retinopathy, this addition can cause problems. It enables the eye to focus on a close object, but optical magnifiers create a virtual image that is further away than the object. Why is that so? A light beam passing through the center of the magnifier lens is not refracted. Let's look at such a light beam which passes the center of the magnifier lens and is not refracted. Light beams passing the lens at any other point are converged. So for example, we have this light beam and it is converged. Now the virtual image is formed where the light beams would cross. Look on the right side of the screen. That is where the virtual image is created on the right side. That is the virtual image. Now, the virtual image created by lower power magnifiers lies obviously further away, let's say, depending on the power, between 10 and 20 centimeters behind the reading material. We have the eye to object distance and we have the eye to image distance, and there is, depending on the power, a difference of, let's say, 10 to 20 centimeters. Now, to see this image clearly, our eyes must accommodate to this longer distance, or they must be corrected with an addition. An ideal magnified image with a good field of view is achieved at a distance of 40 centimeters between the eye and the virtual image. 40 centimeters between the eye and the virtual image. To find the addition necessary to focus at this distance, we use the formula that we all know: diopter equals reciprocal of focal length in meters. That is to say, we divide 1 by 40 centimeters or 0.4 meters, and we arrive at 2.5 diopters. This is the addition we need to focus at 40 centimeters without accommodation. Now, to make things easier for us, many magnifiers have the eye to lens distance printed on the magnifier handle or housing, as you can see here. You see the red arrow, and I'm not sure whether this is really visible from the distance, but on this magnifier there is printed on the left side 24 diopters, and on the right side there is printed the number 100. So that says this magnifier has 24 diopters, and the eye to lens distance should be 100 millimeter or 10 centimeter in order to get the eye to image distance of 40 centimeters. Now, in practice, however, users will prefer to keep a longer distance in order to benefit from a more comfortable posture. So let's go back to Pascal, still sitting on the bench. His stand magnifier has 24 diopters like the one we just saw. As mentioned before, the recommended eye to lens distance for this magnifier is 10 centimeters. His reading glasses have plus 3.5 diopters. Now, do you remember the formula diopter equals reciprocal of focal length in meters? To find out the working distance of his glasses, we convert this formula and arrive at less than 29 centimeters. We divide 1 meter by 3.5 diopters of his reading glasses, which is less than 29 centimeters. So apparently his reading glasses cannot work with his magnifier, since they focus the eyes at a distance shorter than the recommended eye to image distance of 40 centimeters. And what's more, Pascal will probably move a bit further away from the lens than those recommended 10 centimeters distance, for a more comfortable posture. So, wouldn't it be possible, at least in theory, for Pascal to use his stand magnifier with his addition of 3.5 diopters at a very close and uncomfortable distance between his eye and the lens? The answer is no. Even if it would be possible in practice to reduce the recommended eye to lens distance of Pascal's magnifier from 10 centimeters to 0, we still have a virtual image that is 30 centimeters away and thus out of focus for the addition of Pascal for the 3.5 diopters that focus the eye at less than 29 centimeters. We can always calculate the maximum possible addition for use with any stand magnifier by dividing 1 by the lens to image distance, and the lens to image distance is 40 centimeters less the eye to lens distance shown on the magnifier. Please keep in mind, this is a purely academic consideration, as it makes no sense to place the eye directly on top of the magnifier lens. Actually, well, it's impossible. So, Pascal needs a pair of spectacles for use with the magnifier with an addition of not more than 2.5 diopters to achieve the ideal eye to image distance of 40 centimeters without accommodation. In practice, an addition lower than 2.5 diopters will be used because of the remaining eye accommodation and to enable the user to benefit from a more comfortable posture. Consequently, the plus power for the magnifier addition often ranges between +1 diopter and +2 diopters. Eyeglasses in this power are also often used as a visual aid for intermediate distances, such as household tasks. To sum it up, when dispensing a stand magnifier, it is necessary to also dispense an extra pair of single vision lenses fitted with a medium edition that have been adjusted to the use of the optical magnifier. In this way, the magnifier does not end up standing idle on the desk. What's more, in addition to making your patient happy, which is the most important thing, your time and efforts spent also pay off. Just a few final remarks. High power magnifiers can only be used at a very short distance from the eye, and therefore an additional reading stand can help maintain a more comfortable reading posture with a high power stand magnifier. Normally, users do not have all these problems with hand magnifiers. They intuitively adjust the distance of the virtual image by changing the distance between the magnifier and the object viewed. A very useful special kind of magnifier can be the bright field magnifier, also known as the dome magnifier. They can be used together with strong reading glasses, as the virtual image is near the bottom of the dome.